I'm Kristen Hansen, and this is your Henderson Health Report. Going to college offers a lot of new experiences for people. The first time living on your own, having to manage your own time, and being responsible for yourself. Another first for many college students is being exposed to alcohol. A counselor from the Henderson Student Health and Counseling Center, Willika Morgan, tells you why this first situation can easily turn into something that students can't handle.
There's a combination of reasons, the most important one being that it's probably the first time many of them have been unsupervised and have had it as readily available as it is on a college campus. Not the college campus itself, but through social events, fraternities, different parties.
There are several myths about drinking alcohol. Since many people are around it for the first time while in college, it's important to know what's the truth and what's a myth. One alcohol myth is that a person can drink alcohol and still be in control. This is completely false. Drinking impairs judgment. It increases the likelihood that you'll do something that you'll regret, like drinking and driving, having unprotected sex, or letting yourself be victimized by others.
Students might come in because they did something while under the influence of alcohol that they regret now, but they can't take back. And so they're having to learn how to live with the decisions that they've made.
Another myth is that drinking alcohol isn't dangerous, when in fact the National Institute on Alcohol Abuse and Alcoholism stated that 1 in 3 18 to 24-year-olds who are admitted to an emergency room for serious injuries is intoxicated. Drinking alcohol can also lead to other serious health problems like depression. It's also associated with homicides, suicides, and drownings.
Many of them think of it as a game a lot of times. There are a lot of games that happen at parties that encourage students to drink as much as they can, as quickly as they possibly can, and a lot of them don't have the self-control always to be able to resist that. And then add to that the peer pressure of wanting to do what everyone else is doing, and it makes it hard for them to be able to resist.
Some people think that eating, taking a cold shower, or drinking coffee can sober you up more quickly. This is another myth. It takes about 3 hours for alcohol from just 2 drinks to get out of a person's system, and nothing can speed up this process.
There's always the health risk, alcohol poisoning, which is something that can happen to them as a consequence. And then there's also the emotional things they have to deal with. A lot of times what alcohol does is it lowers your inhibitions. So you're more likely to do things that you'll regret, things that you wouldn't normally do if you weren't under the influence of alcohol.
Yo, what up? This is Polly Shore and you're watching HDTV. HTTV. KS what? Yo, what up? This is Polly Shore. You're watching HTV. Check it out. Is that good enough?
Unfortunately, one other common drinking myth is that a person can drive without any problem after just a few drinks. About 1/2 of all fatal traffic accidents from college-aged people involve alcohol. The risk of a fatal crash increases as a person's blood alcohol content increases.
It can become very easy for students to become sidetracked by the social aspect of being in college. And drinking is one of those things that once they engage in doing that, then it may make them feel good, it may make them not worry about things, and so they could become less likely to focus on their schoolwork because they're so sidetracked by the alcohol, and it's not just the alcohol itself, it's the social aspect that goes along with it, the parties, the having fun, the hanging out with friends. So the combination of all those things can make it hard for a student to remember the main priority of being in college.
Data from the National Institute on Alcohol Abuse and Alcoholism show that young adults aged 18 to 29 are more likely than any other age group to have drinking problems. If you think that you or someone you know may have a problem with alcohol, it's important to see a doctor or some other healthcare provider like the HSU Student Health and Counseling Center immediately. They can help you figure out if a problem does exist and offer the best treatment plan.
The inability to practice self-control when they feel like they don't have control over it anymore, when it's preventing them from doing normal everyday activities that they were previously able to handle. Anytime anything affects your normal everyday life, then that's when you cannot begin to identify it as a problem.
That's your Henderson Health Report for this week. Be sure to tune in next week for more health news. I'm Kristen Hansen.